Hello, Grace.
Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes the deep interconnectedness of animal, environmental, and human health, affirming that a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become custodians of their own well-being. Through our hybrid Learn to Earn sessions, conducted both virtually via Google Meet and at physical locations, we engage participants from diverse backgrounds. These weekly sessions serve as dynamic platforms for learning, discussion, and collaboration. We focus on the co-creation of knowledge through the Learn One, Do One, Teach One approach. This method ensures that each participant not only learns valuable health information, but also applies it and teaches it to others, fostering a ripple effect of empowerment and education. By participating in the Actuate Health Access Program, individuals gain the tools and knowledge needed to improve their health and the health of their communities. Our goal is to create a network of informed and proactive health custodians who can address health challenges in a sustainable and impactful way. Join us in this journey towards better health for all. Together, we can make a difference. Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes the deep interconnectedness of animal, environmental, and human health, affirming that a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become custodians of their own well-being. Through our hybrid Learn to Earn sessions, conducted both virtually via Google Meet and at physical locations, we engage participants from diverse backgrounds.
Hello, Anthony. We can begin.
Uh, Thank you everyone for attending to our session today. Um, I wish to welcome you all to old enough. Hope I'm audible enough. Welcome to our today's session, where we will explore an innovative approach to addressing one of the most critical healthcare challenges: funding prenatal care. Maternal and child health is the cornerstone of any thriving community, yet access to quality prenatal services remains limited in many parts of the world due to financial and logistical barriers. This leaves mothers and children vulnerable to preventable health risk. Today, we'll discuss how the Actuate token, a blockchain-based digital asset, can be utilized to revolutionize the way we fund prenatal care. This is not just a conversation about technology. It's about creating sustainable, transparent, and impactful solutions that empower communities and save lives. As we dive into the topic, think about the real-world challenges faced by low-income regions: the lack of medical supplies, understaffed clinics, and the absence of proper monitoring systems for healthcare delivery. Now, imagine a system where resources are actively involved in shaping their healthcare features. This is the promise of Actuate tokens. Our decision will cover how these tokens can be used to fund community clinics, incentivize healthcare providers, and track health outcomes using blockchain technology. We'll also examine the potential challenges such as adoption barriers and measuring impact and how to address them effectively. By the end of this session, I hope you'll gain insights into how innovation and technology can solve pressing issues which are social. More importantly, I want you to live with a sense of possibility that through collaboration and creativity, we can reimagine what's possible in maternal healthcare. Let's get started with a topic master Pfizer, who will discuss today's topic. Welcome, Pfizer. Pfizer, you're welcome.
Oh, sorry for the delay. Thank you, Ronald. I had a problem with my speaker. I'm Pfizer, and ladies and gentlemen, good afternoon. I'll be going through this session, and I'm the one who will take you through this session of capital formation to fund prenatal care, using Actuate token for capital formation to fund prenatal care. Prenatal care is essential for ensuring the health and well-being of both mothers and their babies. However, in many low-income regions, access to quality prenatal care is limited due to funding gaps and insufficient resources. Actuate tokens and a blockchain-based digital asset offer a transformative solution for addressing these challenges by enabling innovative capital formation and incentivizing positive health outcomes. The Actuate token operates as a decentralized mechanism to fund public goods, including healthcare projects. By leveraging blockchain technology, it ensures transparency, accountability, and equitability distribution of resources. Prenatal care can significantly benefit from this model, as tokens can be allocated to healthcare providers, clinics, and community initiatives focused on maternal health. This funding approach eliminates many inefficiencies of traditional system, creating a sustainable and impactful model for prenatal care delivery. In practice, Actuate tokens can support the establishment and operation of community prenatal care clinics. Clinics can use these tokens to acquire medical supplies, hire skilled personnel, and improve their facilities. Additionally, tokens can incentivize healthcare providers to participate in specialized training or offer their service in underserved areas, fostering both professional growth and better care access. The blockchain system also enables tracking of service delivery and maternal health outcomes, ensuring that funds are utilized effectively and transparently. One of the most significant advantages of using Actuate token is their ability to foster community ownership. By involving local stakeholders in decision-making, the token system empowers community to take charge of their health needs. Partnership with government, NGOs, and private organizations further amplify the reach and impact of these initiatives, creating a network of support that can scale across regions. Despite its promise, there are challenges to adopting Actuate token in prenatal care. For instance, community may initially lack the knowledge to access and utilize the tokens effectively. Addressing this requires robust education programs to ensure inclusivity. Similarity, blockchain technology might seem complex to some stakeholders, necessitating partnership with tech-savvy organizations to simplify processes and enhance adoption. Additionally, the success of such program depends on the ability to measure and evaluate health outcomes. A reliable monitoring system is crucial for ensuring accountability and refining approaches over time. The implementation process begins with identifying areas in need of prenatal care support through thorough survey, community engagement. Once these areas are prioritized, Actuate tokens can be distributed to accredited healthcare providers and clinics. Blockchain technology then facilitates to accredited healthcare providers and clinics. Blockchain technology then facilitates the monitoring of service delivery, ensuring that funding directly impacts maternal and child health. Successful models can be scaled to other regions, multiplying the benefit and driving systematic change. Actuate token not only provide a means, in conclusion, Actuate token not only provide a means to fund essential health care service, but also create an ecosystem of collaboration and shared responsibility by integrating blockchain technology with healthcare delivery. This approach has the potential to revolutionize prenatal care, particularly in underserved communities. It calls on communities, healthcare providers, government, and NGOs to work together in leveraging this innovative tool to ensure that every mother and child has access to the care they deserve. And that marks the end of my session. Thank you. Back to you, Ronald.
Thank you, Faiza, for that wonderful presentation. And I call upon our CEO, Dr. Masharia, for any additional comments or notes. Dr. you're welcomed.
Audio. Hi, Ronald, Anthony. Confirm you can hear me. I was muted. Hi, Ronald.
Yes, we can.
Okay, so good. Thank you so much, Ronald. And thank you very much, Faiza. Faiza Chanda, that's the name. Thank you for telling us what lays ahead, we're going to do with Actuate token. I think Actuate token, and let's say about this token economics, the blockchain itself, very, very powerful. Today we are talking about prenatal care. Prenatal means before birth, before a baby is born. The baby, where does the baby stay? Now, Ronald, tell us, before the baby is born, where is the baby?
Before the baby is born, the baby is well in the mother's womb.
Precisely. When does the baby begin living in the mother's womb? What's the date?
I didn't get your question clearly.
At what time does the baby start living in the mother's womb? Which day? Which day of the year? Of the day of the month? Time of the day? And how do you know that? Who knows that? Who gets to know that? Let me. So what time does the baby begin? Because I think there's a very difficult conversation for a lot of people. When life begins, the baby is human life. The baby begins life at conception, and the mother knows that she has conceived when she misses her period, because after conception there's no more period for another 9 months until giving birth. Then after that, maybe the periods could resume after later on. Last menstrual period, LMP, okay, that is a primary indicator. So let's start from the beginning. So a lady misses her period, and then if you miss a period, one can miss period because of so many reasons besides getting pregnant. But getting pregnant or conception, let's say conceiving life, is the most common reason for missing a period. So as a woman, if you miss your period, 99% chance you're pregnant. Okay? You miss a period, 99% of the time, you're likely to be pregnant. That's called the likelihood ratio. The likelihood ratio of being pregnant after missing a period is about 99%. Of course, the other causes, other things that can cause one to miss a period, and those are classes that you take in obstetrics and gynecology lessons. Let's talk about conception. What happens now after the mother has conceived? She's not a mother yet. You could say expecting mother, sometimes called expectant. Expecting mother has conceived. What is the next thing? What should she do? She should go to the clinic, first of all, to confirm. Now, she can actually confirm without going to the clinic by buying something called a pregnancy test at the local pharmacy or the local drugstore. You can get a pregnancy test where you test whether you actually are pregnant. It's a urine test. So you put a drop of urine, and then you can see whether you get a reaction, a blue reaction. But that's, you will know, the pharmacist will explain to you how to perform a pregnancy test. So when you miss a period, always perform a pregnancy test to confirm or disconfirm occasion for pregnancy or the likelihood of pregnancy. So once you confirm that you're pregnant, what should you do? You should now consult the clinical providers who can provide you clinical services. That means either community health workers or health promoters. You report to them that you become pregnant so that they can put you in the program. What program is this? It's what's called prenatal care program. Prenatal care program. That includes a lot of measurements, tests, weight, blood samples, urine, and everything. So you get into a program where people are going to evaluate your blood counts to find out whether you have sufficient blood to feed yourself and the baby, give your baby oxygen that's sufficient, and other nutrients that you have enough white blood cells to defend yourself from other diseases that may also attack the baby. And so you get a full blood count. And then you get weighed so they can know your weight at the initial, the baseline, called the baseline weight. How many kilos do you weigh? Well, that's going to be very important as you're going along to find out your body weight changes. Because that also has direct implication on the growth of the baby. And then you get a physical examination, look at your body, your breasts, your body tissues, everything. So you get a full physical examination, your heart rate, your heartbeat, your respiratory rate, your blood pressure. All those things come in a very primary visit, which is called the baseline visit. So you get all the baseline data. And then after that, you can schedule maybe 3 months down the road for follow-up, to get ultrasound, to see, to check the ultrasound of the uterus. It's the pelvic ultrasound, to look at what's going on in the womb of the baby, whether the baby is growing properly. Those are called prenatal visits. They are called so many tests you have to do. And then after 3 months, then the frequency of the visits to the clinicians or to the health providers increase. Instead of doing it once every 3 months, you do it once every month. And that is to just continue checking, making sure everything is going according to program, what is expected. Remember, you are an expectant mother. And so that expectation can be monitored. So you have baby monitoring the baby, fetal monitoring the mother. So there's the well woman clinic, where the woman is not sick, the mother is not sick, the expected mother is not sick, the baby is not sick, but it's important to monitor that so she can be sure to carry that pregnancy all to term without any risk. So it is during those tests that the clinicians can detect what they call high-risk pregnancy. High-risk pregnancy, they will know. I don't have to tell you what that is. So it means that for you as a pregnant woman, all you have to do is follow the protocol. That means that you're going to get all the blood tests, you're going to get all the immunizations that will protect you from to boost your immunity. And then you're going to get ultrasound, and if you're high risk, they are going now to tell you what to do in case you need a cesarean section, or you can continue all the way up to 9 months when you can do an SVD. That's called spontaneous vaginal delivery, okay? Which means that you deliver the baby the normal way, it's the normal delivery. Of course, you go through labor. Now, question comes, when you're going through all these things, who pays you? Remember, what you're doing as a pregnant woman from conception, you're doing certain work that is sacred. You're doing a sacred duty. The duty of bringing life.
Hey, what's up? Sherry Grace, Sherry.
Onto earth. Sherry's calling me.
Like to answer.
Hi, Sherry. We're in Learn to Earn program. Can you join the Help Access Learn to Earn so we can? Okay, that's Sherry. All right. So who pays for that? Now, maybe Ronald, they can tell you. Have you ever heard of a woman who receives payment because she went to the clinic to get her vitals checked by the physician, by the gynecologist, or by the, let's say, by obstetrician? Ronald, have you ever heard of anyone getting paid for that? Let's say an expectant mother, even going to get an ultrasound, because she's doing work of value. She's not going there because she's lacking work to do to make money out there like everybody else, but she's going there because she is very, very concerned about the health of the baby. Not just a baby, the human being she's going to bring forth into this planet. And yet, nobody pays her for that. Nobody, no one, not anyone. And if you ask people in the finance industry, what is the value of the work that woman has done? They say, what value are you talking about? Just getting pregnant? What value is that? Can you believe somebody like that somebody asking you such a question? Just getting pregnant, what value is that? Anybody can do it, anybody does it. Any woman, can get pregnant in which time she wants. So what is the value of that? So in the finance system, the value that a woman produces, the value of the work that a woman is producing by attending to antenatal activities or following the protocol is not accountable. You cannot find it in anybody's balance sheet anywhere in the central finance system. And that's why it looks like women have to be pitied. We have to pity women for getting pregnant. And we think that we can only give them money because they're not producing any value. In fact, in many situations, when a pregnancy comes to a certain point, even some employers do not want you to come to work, so you go on maternity leave. Maternity leave. When you're on maternity leave, it's quite common that employers will not pay you for being on leave because you're pregnant, because you're not contributing to any value. This means that in the eyes of the centralized finance system, you are not of any value. See? That is the problem. But today we are saying we have the decentralized finance, which is able to recognize the value of the woman as soon as she gets pregnant at conception. And how do you do that? So when a woman conceives and she does that pregnancy test, becomes positive, immediately reports to the local health center. Then when in its full flower, when actually it's fully developed, the providers and the local health centers will be able to allocate tokens, actual tokens, for free to the woman because of coming to the clinic. She gets tokens. Why is it possible? Just like now we're doing learn to earn, you can receive tokens for coming to class. Similarly, mothers, pregnant women, expectant mothers will receive tokens for attending clinics and following the protocols. And the number of tokens they can receive depends on the number of services they receive. So they receive tokens for receiving what? Services. Because they have actually performed a job to take themselves to the service provider. And that service provider, that work what the service they receive from service provider is work of value. It's not only the service provider who should get paid. The woman who is coming to get herself checked out, she's providing a service by carrying a whole human being in her own body. Okay. Now you can imagine we are willing to pay a bus or even a matatu for transporting us from point A to point B. Yeah. So if you take the matatu is a vessel, transportation vessel. We now consider the woman is a transportation vessel for human life. How much should we pay for that? That question has never crossed the mind of traditional economists, the finance system. How much should you pay a woman for transporting life, taking life in her own body? And how do you pay for that? Well, because that question is too difficult to answer, they just decide to leave it. But then such question is not difficult to answer with a blockchain anymore. It's easy question to answer. So when the lady comes for her prenatal care, evaluation, protocols, baseline tests, she receives token for just showing up. First, what that thing is going to do is going to encourage a lot of ladies who really do not go to seek prenatal care. They would rather sit at home instead of paying money for transportation, getting matatu ticket to go to town, to get to see a doctor, then they have to pay the doctor. No, but instead she gets paid. And that's what we're going to be working on in 2025 to create a smart contract that will be awarding tokens to pregnant ladies for prenatal visits, because they're about how many? They're about 10 prenatal visits. That means they can be paid 10 times for showing up to the clinic. And that means that a lot of prenatal problems can be captured before they actually happen, preventing prenatal death, which causes the death of the mother because the pregnancy was not, the high risk pregnancy was not detected. So we can detect high risk pregnancy by incentivizing consumer demand. Okay, this is demand for care. That's what's about. But we have some ways before we get there. And so that the way we have, because then the road ahead, and this is what came out of the summit, the road ahead. It's called the roadmap. The roadmap has got multiple steps before we can reach that spot. Step number 1 is for all women to have a wallet that can receive tokens. Okay. Every woman must have a wallet. It's possible for every woman to have a wallet, woman of childbearing age to have a wallet. So write this down. Every woman of childbearing age who has got a phone must have a wallet in that phone. And the phone does not only have to be a smartphone, even the USSD phone, that means the Mulika Mwizi, is well able to do these things. Okay, so get a crypto wallet. If you don't have one, get one today. And I think what you're going to do is work on making sure that everybody has got a wallet. The next thing, and this is the one you have to spread throughout, spread this gospel aggressively in your community, everywhere, you know, that we have new economy, which is called the decentralized finance, that is only going to be successful, they're going to be meaningful to you if you have a wallet. Number 2, in that wallet, you need Actuate tokens. So it's no point of having a wallet without tokens. Get Actuate token. There are 3 ways to get Actuate tokens. One is you can participate in the Learn to Earn programs, and you can get airdrops tokens like what we are doing here today. Or number 2, you can buy more tokens by swapping in the decentralized finance platforms such as PancakeSwap. So the tokens are available in PancakeSwap. So you can swap as many tokens as you can afford. Get the largest amount of tokens that you're able to accumulate. That's important. And so number 3, you can get those tokens by buying them directly from Actuate itself. You can call in one in the team and they can tell you how to buy Actuate tokens. So these tokens are available. That is the first step, that we want to make sure that people are familiar with the token by getting them in one of those 3 ways. Come to the Learn to Earn session, accumulate tokens. Then also, you can buy so many tokens on your own by swapping them using other crypto tokens, such as Ether or ETH, or even BNB coin, or even Bitcoin, or even Bitcoin. So get Actuate token. And you can say, why don't we just have Bitcoin to do this work? So Bitcoin was created for a specific job, and it is doing that job already. But Bitcoin was not created for prenatal care. So Actuate is specifically created for that purpose. And that's why you want, if you have Bitcoin, get Actuate also, so that you can gain access to that prenatal care service. Because it's a computer program. A computer program does what it's designed for. For example, you cannot do things with PowerPoint that you can do with Excel spreadsheet. Okay, so Excel is created for a specific reason. And so although it's a computer program, Excel does Excel things, and PowerPoint does PowerPoint things, each and of its kind. Same thing here with the blockchain. So tokens such as Actuate will do the job that they're designed to do, and then Bitcoin will do the job that it is designed to do, each and of its kind. So you understand that. It's almost like saying an orange tree will produce oranges as fruits. So you'll know them by their fruit. A mango tree will produce mangoes. There's no day in the history of mankind a mango tree has been known to produce oranges. Never. And there's no day in the history of mankind an orange tree was found to produce mangoes. So that is why these things are very specific. Life is very specific like that, as it is written in Genesis. Each with its kind. See, that's what it means. Each with its kind. Okay? So horses give birth to horses, and cows give birth to cows. So Actuate token will give birth to health access for prenatal care, while Bitcoin is going to give birth to the speculation market that you find in the stock market. See? So that is why if somebody asks you such a question, then you know what to tell them. So we're saying Actuate token. So you need to have these tokens with you in your wallet, and you want to accumulate as many Actuate tokens. Just like if you're accumulating Bitcoin, you can accumulate as many Bitcoin now for speculation reasons, but you would be accumulating Actuate token for two reasons: one, to speculate, and also to help finance universal access to prenatal care. So then how does that become capital? That's the question. And today we are talking about funding. We cannot fund a project without capital. Capital occurs, and I want you to listen to this very carefully, because in Africa, we have not understood the meaning of the word capital. Capital, to give you an example, say of a piece of land. If you have a piece of land, say like 5 acres, you could say that piece of land has lots of capital on it. But I will tell you very truly that unless you have a title deed for that piece of land, the capital in that piece of land is dead capital. See, capital has got two states of existence. Capital is either dead or living or dead. What turns capital, dead capital, into living capital? It's its mode of representation in the marketplace using something else. It's called a certificate. For land, is title deed. For tokens, you can have token that is not liquid. So the title deed is what makes your land liquid. Your land, piece of land, is solid state. It's solid. You cannot take it anywhere to anybody to tell them that you got a piece of land. But once you have the title, you can now take that title to anyone and tell me, I've got 5 acres in Kilifi. Now you could be in Nairobi and you're telling somebody you've got 5 acres. Where is it? This is the title deed. You show them the title deed. That person actually believes. And even if you want to validate, to verify that there is such a piece of land, he's not going to go to Kilifi. He's going to go to the Ministry of Lands, the Register of Titles, and if that title is registered there, then it's going to confirm that you have a piece of land in Kilifi without going to Kilifi. See, that technology is known as representation, and that's what forms capital. It's what's something called liquidity. But that capital, in Kenya, in Africa, we do so many things that have no representation everywhere. So first of all, the actual token itself represents the value that you've produced. Like, say, the woman going to the clinic, seeing a doctor, and it gets actual token. That value is already encoded on the blockchain. It's like a title deed of that visit. But that visit is not really totally liquid, because you have to show that title deed. You have to present it in the market, just like you can take your title deed to the bank to borrow money from it. So how do you do that? You take your tokens and you put them in a liquidity pool. And that's what everybody must know how to do. And that's when you start forming capital. So liquidity pool means taking your actual token and combining it with another token such as Ether, such as BNB, such as Bitcoin, whichever. When you tie those two together, the whole thing becomes liquid. So, and something fascinating that you want to learn about this science is that when you take your actual token, the actual token is inside your wallet. And you connect your wallet to PancakeSwap, for example, decentralized finance platform. When you connect your wallet to the decentralized finance platform, like PancakeSwap, then you can supply to supply liquidity or to add liquidity to create a liquidity pool. You are going. PancakeSwap is designed in such a way that is going to connect with your Actuate inside your wallet, and then it's going to help you tie that actual token, or level of actual tokens with another token like BNB. So those tokens are together, BNB and actual token are in the liquid pool. They're in your wallet. They're in your wallet during that time you are doing all this stuff. But when you add them to the pool, they actually do not leave your wallet. That's the crazy part you want to understand. The tokens are not going to desert your wallet and go somewhere else. They're going to stay in your wallet. But what is in the liquidity pool is a representation of what is in your wallet. Okay? For example, when you go to the bank with your title deed, your land does not depart from you. Your land is still yours. You can still live there and still continue cultivating crops in that piece of land. But your title deed is in the bank. Okay? So it's a mode of representation that is very fascinating. That's called transmutation. And when you're now in the liquidity pool, you can earn money by supplying liquidity, that you become a market maker. And I think everyone in this session, and even if people listening to this maybe in YouTube in the future, the thing to know is how to create a liquidity pool. Because once we've created liquidity pools, then the actual token becomes a liquid, that the tokens that we are giving supplementary for incentivizing health consumer behavior, for example, incentivizing young ladies to seek prenatal care, those tokens are going to be liquid and they can use them for making purchases or doing things. That is the first step. You can see there are 3 steps. Step 1, get a wallet. Step 2, get actual token. Step 3, create a liquidity pool. Okay, that's it. Create a liquidity pool. And that's if everybody was to do that, get hundreds upon hundreds of people doing that, then there's going to be liquidity for funding. So the funding now we're talking about, like for creating physical structure, physical infrastructure, like building clinics, hospitals. We're now going to raise money using what you call quadratic funding or retroactive public good funding. Which now these are new technologies for fundraising that are very innovative on the blockchain, that now we're able to raise lots of money. But the first requirement is liquidity. Liquidity created in the liquidity pools. So I want you to understand that, and what we're going to be working on in Actuate for the next say 1 month or maybe 2 months until the first quarter of 2025, beginning even now, is understanding liquidity pools and how every one of us, including yourself, every one of you, creates a liquidity pool. Okay, you create a liquidity pool and you get hundreds upon hundreds of those liquidity pools. The actual token becomes liquid. That means that you take the tokens you have and then tie them with another token and create a pool. And there is no point of having actual tokens in your wallet without putting them in a pool. See, that is an adventure in missing the point. So the point of all this is creating a liquidity pool. You see that? That's the point for all this. That what you have said about funding prenatal care, it will not happen unless all of us, every single person, creates a liquidity pool. That's the duty. And that way we're going to fund prenatal care. Now, what's the incentive? Why would you want to create a liquidity pool? You want to create a liquidity pool for 4 distinct reasons. One, the tokens, even in your wallet, they are not gaining value. They are just going to be sitting there. It's like having oranges that you have grown oranges and you're not taking them to the market. What's the point of that? You can be holding tokens in your wallet, but they are not in the market. So liquidity pool is the market where you begin to sell things. Now, the liquidity pools, the way the liquidity pools is designed, it's so that it can be earning you money about a small part. Every transaction that happens, you receive some kickback because you are providing liquidity. Okay, you're providing liquidity, so you get some kickback from it every single time this transaction. So you earn money. In addition, liquidity pool gives you something extra, like an NFT token or an LP token. That LP token has got as much liquidity as the liquidity pool itself. And you can use it for other things like borrowing or lending if you understand this market very well. And this is why we're going to double down in training people how to do those things. What do you do with the tokens when they're in the liquidity pool? Lending and borrowing. And then the fifth thing is that you can do what's called staking a token. So that is what it's all about. And I think it's very, very important that everyone learns about liquidity pools. Because as I explained to you, something before, that the liquidity pools are the holy of holies in finance. They are the inner sanctum, the holy of holies, where in the traditional finance, that holy of holies is accessible to only a few people. Let's call them the high priest of finance, just like King Solomon's temple, where only one person could go there in the holy of holies, the high priest. So the high priest of finance are the ones who are doing all these, these procedures for what's called market making and etc about finance. Now that curtain that is blocking people from getting into the high finance has been split wide open, and you are now like the high priest with your phone, so you can participate in that liquidity pool and do all that is needed. And of course, you make a lot of money as long as you understand. So this is what I would now during this. Today in Kenya is Jamhuri Day. Jamhuri Day is the day of the Republic, when Kenya was recognized as a republic in the United Nations, the League of Nations. So the liquidity pool is when you get admitted into that League of Nations of Finance. It's a League of Finance. As an individual, not as a whole nation, as a person. And that's what's called the sovereign individual. You become sovereign, the sovereignty. So in Kenya, the Jamhuri implies that Kenya was recognized as a sovereign nation. Sovereign nation. Sovereign means taking care of their own kingdom. Reign is the word kingdom, sovereign, intrinsic. But that is the whole nation. Now what you're saying is not about the whole nation, but about you as an individual. You are a sovereign individual. And that's why you want to understand liquidity pool. You have 5 ways of making money in the liquidity pool, but you cannot know those 5 ways unless you believe. See, believe is an absolute requirement. there's no way of knowing things unless you believe. So if you believe, then learn as much as possible about liquid pools. Ask questions and ask 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 Ronald, Anthony, ask Frida to help you create a liquidity pool so that you can continue living as a sovereign individual. You can be celebrating your own Jamhuri as a sovereign individual. Jamhuri is beyond independence. There's one state called independence, the next state is called Jamhuri. And that Jamhuri indicates your ability to practice or to exercise your knowledge. That is what's called sovereignty, that ability to exercise. And then you get admitted into the Holy of Holies. So it means that you're admitted in the Holy of Holies right now. Now, all you do is use it. So that's what I would like to say about these things. And please ask questions, comments, and philosophical thoughts. You can post your questions to the chat box below. But take time this Christmas learning about liquid pool, everything about how to take Actuate token and create a liquid pool. Learn all the benefits because they're only benefits. I can tell you that. If someone told me there are no benefits, tell him that he's reading another script from somewhere else. This kind of thing has never happened in the history of mankind. And so, yeah, learn about the benefits of being in a pool and create one. Okay. So, Ronald, Anthony, back to you.
Thank you so much, Daktari, for the wonderful speech and comment, and we really do much. Thank you for your additional notes and comments about the topic. Anyone with any question, you can raise up your hand or you can write in the chat box. As just want to appreciate, I also want to appreciate the topic master Faiza Chanda and Daktari as well. As I'm sending the link to the attendance form, if you've got any question, you can write in the chat box. Feel free. I've posted the link to the attendance form. So the moment you are done with filling the form, you are free to leave. Or Daktari, if you've got any other additional comments, you can please do so.
Well, I don't have any additional comments. I think what we do is that we make sure that I think what Anthony, you can post that video about how to create liquid pools so that people may understand. You share that video. Are you able to share your screen?
Let me check for the video on how we can create liquidity pool and then share my screen.
You have access to it. I think somebody posted it yes, minutes ago. 1 second, let me see.
27 minutes ago, 36 minutes ago. Raise Barry while you're on. Actuate Nation, let's keep joining. The session has started. Button. Action once now. 36 minutes ago. Once now. 48 minutes ago. Freedom you tell Brilliant Group. Actuate community. Link symbol. Join our Cloud HD video meeting. Like once now. 27 minutes ago.
No.
Backhand index speaker with the dark skin tone.
So
I'm actually searching for the video. Just a minute.
if you want our WhatsApp groups, very easy to find, I think. But but what you can do, because that video is about 8 minutes long, is that you can set it to the groups, the Actuate Nation in WhatsApp.
Yes, sir.
So, but everybody make sure you watch that video very, very carefully to understand how to create a liquid pool. Okay? Watch that video very carefully, because once you have understood that, then everything else is everything else everything else just flows. Okay. All right. Let's start from there. My throat is closing down. I have no reason why. All right.
Thank you, Dr.
Yeah, thank you, Fraser. Now, I think we can send us that article so we can publish it in my article by Fraser. So thank you so much for the lesson.
Okay, sir. You have a good one.
Yes,